Hi, everyone. My name is Lauren Brown, and I am from Boston, Massachusetts. First, I just want to thank the EDS Society for inviting me, but mainly for just existing in general, because if I didn't have the EDS Society to find out information, I would have never been able to claim my life back. I've definitely watched every presentation you've ever put out, except the ones that aren't in English. So I have no real disclosures other than I am a SAG-AFTRA actor, but I'd like to mention I'm not acting right now, nor have I ever acted in any doctor's office ever. Just want to make that clear, okay? So quick backstory about me. I started having pretty bad symptoms of POTS and EDS when I was 11. I did not get diagnosed till I was 32. I did not find any kind of treatment or management till I was 40, which was just 4 years ago. So 2 years ago, I decided that I would start a YouTube channel to get awareness out there that people can advocate for themselves. Because when I was diagnosed, the doctor said, this is what you have, and there's really not much we can do for it, so it is what it is. And if I didn't take things into my own hands, I don't even want to know where I'd be. So what I do is I do 2 to 4 minute episodes about everything EDS and POTS related. They are all ADHD friendly because I have ADHD and I bet some of you do too. So I like to keep it short. Get as much information as I can without being too confusing. And we'll just get into it. So today I'm talking about bladder dysfunction. I don't know if I mentioned, I've been peeing my pants for about 2 years. Anyone else? No? It's okay, you can laugh. I like to lighten the mood when I'm talking about bodily functions. It helps. Okay. All right. So we can really divide bladder problems into 3 main groups. Gotta go, can't go, and ouch. So you either have incontinence, you've got retention, or you've got bladder pain. These are the tests you should have to decide what's going on with you. Especially if you suffer from POTS, you definitely want to have the electromyography to see what those nerves are doing. And I know this has already been said, but women with EDS are 4 times as likely to have incontinence because, of course, we are. I mean, just add it on, right? It's fine. Just add it on. Okay. 2 types of incontinence. We've got stress incontinence and urge incontinence. Stress incontinence is urine leakage when we're doing anything, talking, walking, singing, breathing, existing, basically. Urge incontinence, you're going to the bathroom more than 8 times a day, more than 2 times a night. Or you've got, what they call nocturia, which is peeing a lot at night. The things that they can do for these is pelvic floor exercises. They can use a pessary to support things that have moved around, a bladder sling, and some injections. This is the treatment for urge incontinence. The first line therapies starts with the avoidance of bladder irritants. What do I mean by that? Let's see, coffee, tea, alcohol, soda, dairy, corn syrup. Basically anything that brings you joy in your life is gonna irritate your bladder. It's fine. Then bladder training, you can do bladder control strategies, pelvic floor training. You can manage your fluid, which I can tell you is really difficult with POTS. If you don't get that water-salt ratio right, it's all downhill. Weight loss and then patient counseling regarding OAB symptoms. It's a second-line therapy, which are these medications. I'm not going to read through all of them just because 70% of patients stop taking it within the first 6 months. And these are the side effects. Dry mouth, constipation, dry eyes, blurred vision, dyspepsia, UTI, urinary retention, impaired cognitive function. I don't know about you guys, but that sounds like a typical Tuesday, okay? I don't need to double down on those. Like, I'm good. So we've got third line therapies, a better medication that is not supposed to have so many side effects. It's called Myrbetraq, is one of them. Then there's fourth line therapies where they can stimulate your sacrum by basically putting in something like a bladder pacemaker. And you can also go and have peripheral tibial nerve stimulation, which is the nerve that runs up to our bladder. And if you go into the hospital, have it done, they basically take acupuncture needles, put them on those points, and then stimulate them. But there was just a study done not too long ago that suggests that electrical stimulation with a TENS unit, which I have pictured there, which we all probably use for different muscle pains, works just as well. And that is 60% effective. And then you have the Botox, but the problem with that is you've got to get it every 5 to 6 months. Just a little quick backstory about my personal urology nightmare. My personal urology journey. So yeah, I started peeing my pants 2 years ago, so I thought, okay, I go to YouTube, go to the EDS Society, watch everything that I need to. Pretty sure I've narrowed it down to it's either gonna be my pelvic floor, because we've got all those weak muscles, or it could be a neurogenic bladder because I have POTS. So I make an appointment with the doctor. I go in, I introduce myself, I say, I have EDS and POTS, and I do know a little bit about it, and so it's either gonna be my pelvic floor or a neurogenic bladder. I said, but we know it's not my pelvic floor because my PCP sent me for pelvic floor therapy. And when I got there and the pelvic floor therapist examined me, she's like, you have a really strong pelvic floor. I'm like, really? She's like, yeah, like 1 to 10, you're like an 8. I'm like, stop it. I've never, ever scored that high on anything. Thank you. So she's like, well, it's not that. She goes, but by looking at you, you have some other issues, so we can work on other parts of the body. I said, great. So we know it's not that. So I said, I'm guessing it's this neurogenic bladder. And the doctor just says, no. I was just about to launch into my POTS and EDS TED Talk, but then I was like, you know what? I said, are you still gonna let me try the medication? He goes, oh yeah. I said, great, perfect. Gives me the prescription, I pee in a cup, just urinalysis, that's the only test I had. Went home, opened up the pamphlet, started reading about it. He had told me there really weren't many side effects, which was great, but I don't believe anyone anymore. So I just was reading through the pamphlet and saw that it does, Myrbetraq has an interaction with something called THC. The THC that's in my medical cannabis, that is my rescue drug, that is my lifesaver, because you people can't give me anything that works as well. So I do have to take that. I had told you that, and it is all over my chart. So yeah, is that gonna interact? I don't think so. I think you should be fine. And that's when I heard my safe word, should. It's my safe word in that when I hear it, I don't feel safe anymore. You don't know what you're talking about. Have you had other patients on medical marijuana who have taken this drug? I was concerned because one of the side effects is pretty bad. I can't make this stuff up, you guys. It's something called scromiting. It's vomiting so fiercely that you scream. I was like, I think I've done that before, and it's because I was having these acid problems, so I do not want to go back there, at all. Don't want that to happen. So, I decided that for me, it would be best to avoid bladder irritants and to do the TENS unit on my peripheral nerve. So I did that for 3 months. And I really have to say, if I avoid the irritants, did the TENS unit, it really did make a big difference. Did it help completely? No. Will I try the medication eventually? Probably. Will I need some PTSD therapy first? Yes. Back to bladder issues. Okay. So when it's a no-go, when you can't go to the bathroom, inability to urinate, difficulty initiating a stream of urine, you get lower back pain, pain in your abdomen, disruptions to the urine stream, a weak urine stream, an urgent need to urinate followed by a light flow of urine, or the urge to urinate immediately after urinating, which is my favorite because it's redundant. And then the leakage of urine while asleep from overflow. So you won't be able to pee during the day, but you'll wet the bed at night. So it's good. These are the reasons for retention. There are quite a few. Pelvic organ prolapse, as we've already heard about. Things can shift around. Kidney infections, bladder infections. The pelvic floor can be too tight and the urethra can't relax. It used to be called Fowler syndrome. Kidney issues, constipation. I don't know if any of you are permanently parked at constipation station, but that affects the bladder. So there's that. Urethral obstruction, urethral stricture, urethral inflammation, weak bladder muscles, cystocele or rectocele, which is kind of a pouch that forms in like your nether regions, like where it's not supposed to be, so they gotta move that away, or bladder outlet obstruction, which is when the base of your bladder, something is blocked and the urine can't get out. These are all the medications that can cause retention. Just on a quick look, I'm on like 3 of them. So I don't know about you guys, but who knew, right? That all of these could actually cause you not to pee. I had heard a story about a girl who had retention. She was a normal person, didn't have EDS or POTS, and she couldn't pee. Her bladder was about to explode. She ends up in the emergency room. They drain her bladder. They're like, we have no idea what's wrong with you. Like, this is like crazy. I've talked to all the doctors. Like, no one has any idea why you can't pee. So she's like, they kept me overnight because they didn't really know what to do with me. She's like, the next morning, a doctor stuck his head in the door and said, hey, so have you been have a cold or feeling sick, cough or anything? She's like, yeah. It's like, have you been taking medication for that? She's like, yep, Dayquil and NyQuil. That's why you can't pee, because of the Dayquil and the NyQuil. So luckily a doctor had come in who figured this out and they let her go home and she was fine because she stopped taking the Dayquil and the NyQuil. Treatments for retention, which we've already heard about. You can drain the bladder via catheter. There are other medications. There's all kinds of crazy surgical procedures. My favorite is like the water vapor therapy, where I guess they blow vapor into your urethra to open it up. And I'm like, the doctors can't notice any kind of like weird things going on, like instability with us, but they can do these things with steam. I don't get it. Okay. Then you have pelvic floor physical therapy, which is awesome, if that's the problem. And then bladder training. And then the last, we've got painful bladder syndrome, and I'm just gonna call it icy, because I don't like saying those words. And there's a couple of reasons. Pelvic floor muscle problems, UTIs, which we get all the time. We can have tethered cords, mast cell reactions, POTS, any kind of autoimmune response, defective gag layer. You've heard probably it referred to as a leaky gut, or my favorite, unknown. These are the treatments. Again, they have a couple of lines of treatments. The first line is just general relaxation, stress management, then pain medication, and I was surprised to hear that there are these aloe vera tablets you can get over the counter that are specifically for IC that are supposed to help bladder pain, allegedly. Adequate water, dietary modifications. That doesn't work. We go to the second line of treatments, which includes other physical therapy techniques, different kinds of drugs like antihistamines. If you have a mast cell reaction, taking an antihistamine may help your problems. We also have injections they can do into the bladder. And then the third line treatments are cystoscopy, which is stretching out the bladder, a sacral implant, again, that bladder pacemaker, and Botox. So interesting enough, they did a little study about women who have EDS and urinary tract infections. And they did a study of 22 women, And out of that, only 10% of their urinalysis was positive. So if we have no other reason to bang our heads against the wall already, we can totally have a urinary tract infection and our culture come back totally normal. So that's good to know. So if they're like, you're normal, be like, I'm not, and I'll tell you why. Why does this happen to us? Again, we're super lucky, but bacteria hides in our bladder walls, and the activity of the main enzyme for the metabolism of histamine gets all screwed up. And we also have less of a protein that's important to our immune system. So for all these reasons, they're like, yeah, no, you're fine. You're fine. Good news. There are UTI vaccines now, which is great. There's one called Uromune, which is out of Spain, and it reduces the total number of UTIs by 70%, which is great. You use it daily for 3 months. It's a pineapple spray under your tongue, very few side effects. It was approved in the United States for compassionate use until an American company created a vaccine and they got through their first trials and they found that it worked. So they will give us the vaccine. But the caveat is only if the UTI is life-threatening. Okay, so if it's gonna kill me, you'll give it to me, but the treatment I have to take to get rid of it may also kill me, so like I'm between a rock and a hard place here. So this sounds great to me, and what I tell people is you have to take control of your own life, and there's nobody telling you you can't go to Mexico and get a side of vaccine, because who knows when it's gonna get here. Canada already has it approved. I mean, you could definitely contact this American company who does the FIM-H vaccine and explain things, but again, they're probably pretty much focused on the bottom line, so they probably won't be a big help, but we're hoping it comes out sooner than later. So the moral of the story is whatever you're having problems with, whatever the doctors tell you is or isn't wrong, use your discretion. I grew up in Boston, so I was under the impression that I lived in one of the best medical cities in the country. I have not experienced that. So people come from all over to go to Boston, and I sometimes wonder why and where are you going? You know, I do this YouTube channel because it makes me sick to my stomach to think that there are people sitting home on the couch thinking their life is over. I thought mine was over at 36 when my body started to fall apart. And for years, I just accepted it. It was like, all right, this is my face. This is my fate. This is my life. Thank God I found the EDS Society, because I was like, oh, wait a second. There is stuff you guys just don't know about it. So by coming here and learning about it, I could literally take control back of my own life. And I will just end today with how I end every YouTube episode I do, to remind you to stay strong, to hang in there, and not take crap from anyone. And I mean anyone. Even if you go to Harvard, we don't care if you can't help us. Thank you.